And do you see it a lot?
We do. My practice is actually a combination of cosmetic surgery and reconstructive surgery, and throughout the years I have continued to perform breast reconstruction. And there have been incredible advances in technology, and one of the things that we are able to do today is genetic testing. And the gene that you're referring to is also known as the BRCA gene. And women who are carriers of the BRCA gene have a significantly higher likelihood of developing breast cancer during their life. Well, given the information of being positive for the gene allows a woman to take a proactive stance and decide whether or not she will proactively do something for the potential that she has of developing cancer down the road.
Right.
And many women do opt to undergo prophylactic or preventative bilateral mastectomies. And of course it needs to be bilateral, removing both breasts, because we don't know which of the two breasts, or possibly even if both breasts are going to be involved when the cancer strikes. This is covered by insurance. This is proactive, this is preventative, but it is 100% covered by insurance. So many women choose to undergo a prophylactic or preventative mastectomy. Well, the defect that's created by that operation is potentially devastating.
Yeah.
And realistically, the breast is part of a woman's sexuality, it's part of her being. And to remove that will remove one of the essential parts of being a woman and of her own identity and being a person. So that what we're able to do for women who do opt for a prophylactic mastectomy is to perform a reconstruction. And again, the reconstructions are covered by insurance, and there are some wonderful options that are currently available, and they all will create beautiful breasts, and we're able to achieve symmetry and natural results. Sometimes even we're able to achieve results that are even nicer than the breasts which were removed.
Sure.
So I find that prophylactic mastectomy with reconstruction is one of the very rewarding parts of my practice, in that we have women who are taking a proactive stance, they're doing something, and they are extremely satisfied with the outcome.
Yeah, I thought that was so courageous on her part, and I was so proud of her. And more importantly, I was proud that she was being open and verbalizing. And she was a stand for her commitment to her sister, her well-being, and to bringing this message out to the community, which was really pretty great. Tell me about statistics and some percentages, not like I want to get flogged down with all sorts of numbers, but the older that we get, and I happen to work with a large clientele base over the age of, I would say, 55, and like we discussed earlier about the graying of America and or the baby boomer getting older, my job is to have them not outlive their money, to have them live wonderful lives, to give them the confidence, the peace of mind, to be able to run and live and travel and eat and spend time with their children and grandchildren. But very often, as I've shared with many of my peers and clients, I don't think anybody should ever retire, because you can get bored, or you can get sick, or there's only so much golf and gardening you can do. And then ultimately what we have found based on statistics is people get bored or tired or depressed and possibly turn to drugs or gambling and alcohol. So I'm a big proponent of working. I'm not saying full time, but working and continuing to get dressed and feel good. So what is it that you see, and what is it you're telling people from, I guess, from an aesthetics perspective?
Well, I think what we're finding is that we are all leading very active lifestyles, and life doesn't stop at 65. It doesn't even stop at 72. But we continue to be active in either athletic endeavors or in family endeavors, and many times in professional endeavors. And those activities will take us well into our 70s or even 80s. And we're also, I think, finding that there's a tremendous amount of competition from a younger group. And as a result of that, many of us want to maintain a certain appearance about ourselves. We don't want to look like we're 20. We want to look natural, but we want to look like a very youthful age. We want to be able to manifest a sense of inner confidence and a sense of well-being, and the plastic surgery will help us to do that. We're finding statistically that over 10 million plastic surgery procedures are being performed a year. That is about 8 million non-surgical procedures and about 2 million surgical procedures. So as technology continues to improve, we are seeing a greater increase in the non-surgical interventions, the fillers and the Botox, which occupy probably about 50% of the non-surgical procedures.
Amazing.
It is amazing, actually.
Yeah.
When you consider that Botox was FDA approved in 2002, that's basically a track record of 8 years. It's now the most common non-surgical procedure that's performed in America today.
Do guys get Botox?
Absolutely.
Where would a guy like myself maybe get some Botox? On my face? Is that what Botox is primarily for?
Yes. Botox actually will temporarily interfere with muscles. And many times what we find is that muscle activity or muscle action is ingrained. So we develop these little frown lines here from the fact that we're constantly crunching small numbers or looking at a computer screen. Well, Botox will relax these muscles. Once these muscles are relaxed, the eyebrows open up a little bit, and it gives a much more open appearance to the eyes. Botox is wonderful. I love it.
So look at me now, and then look at me, I don't know, tomorrow. I'm not there yet. I have a question. So given that I work with an older clientele base, I would say 55 to 75-year-olds, is there a generation listening for your business?
Absolutely.
Tell me.
Absolutely.
Yeah.
Interestingly enough, about 25% of individuals undergoing cosmetic procedures are within that age range. And in that age range, we're looking at primarily a facial rejuvenation. We're looking at eyelid lifts and facial tucks, and we're also looking to a large degree at improvement in body contouring. The love handles or the gynecomastia or breast enlargement in men, and of course just general body contouring in women. And I think that's related to the fact that we are, again, leading a more active lifestyle, that we are working out and exercising, and we are looking to look our best and to feel our best, which plastic surgery helps us to do.
Helps, sure.
Absolutely.
Sure. And you're still passionate about this business.
Completely, and I think I'll be passionate for the next 20 or 30 years.
When does Beverly want to retire?
Never.
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 Got it. Got it. That's good. That's good. Yeah, you know, I'll watch TV or I'll be listening to people talk about how people are looked at, and they can spot someone automatically that they had some work done. Is that true?
No, absolutely not.
Tell more.
They can only spot the people who have had excessive amounts of work done. When cosmetic surgery is done properly, you cannot identify it. You cannot tell that Botox has been given or that fillers have been used. You can't tell a facelift, and you certainly can't tell a body contouring.
Right.
So when it's done by qualified, well-trained physicians, the results are very natural in appearance. Now, if someone came to me and said, I want to look plastic, could I do that? Sure. Absolutely.
Right.
Do people say that? Very, very rarely.
Right.
You know, I think the concept of extreme makeover is really a media concept, and it's not a reality concept.
Are you often fixing problems that maybe went bad?
Often, no. But do we have to correct problems? Sometimes we do. And I think it's part of the industry. Realistically, we're dealing with a human body. We're dealing with minutia and variations within the anatomy of each and every person that we deal with, so that we sometimes do have to tweak or correct issues that may be problematic or that a patient is just not completely satisfied with.
Right, right. Yeah, I appreciate this kind of conversation because, like I said earlier, when we're sitting down and we're talking about doing financial planning and retirement planning, very often I think we share this holistic perspective, which is you need to eat right, you need to drink enough fluids, and you need to exercise. And how you treat your body, your castle today, at the age of, say, 50, will clearly have an implication as to how the body is and reacts when it's 60, 70, and 80 years old.
That's very, very true. And that's one of the reasons why I incorporate the whole concept of age management into my practice. I think what we've found in today's environment, kids spend an incredible amount of time on the computer, playing computer games, texting. I mean, they've got great thumb power, but you know, their muscle activity is markedly diminished. And I think it's very important that we get out there and we promote the concept of physical activity. And in much the same way as doing brain teasers stimulates the brain activity, so too even a modicum of exercise will stimulate the body and help to maintain a healthy condition.
You know, it's funny. I was with a peer of mine just over the weekend, and he was going to punish or take away his son's cell phone and his son's laptop. And he said in this punishment, "I'm taking this away from you, now go outside and play." Well, I started laughing because growing up as a kid, I didn't have a laptop, I didn't have a cell phone, and all I did was go outside and play. So it's interesting how times have changed, where we're now, as a punishment tool, and I'm using this as an example, that we're taking away technology and causing our children to go outside and play like it's something that like it's bad, like it's something that, okay, now you can't play with all this technological equipment that we bought for you to enjoy.
I think as kids get older, they'll realize what they missed in terms of their childhood and not being able to go out and play and not being able to have that personal interaction.
Sure.
And I think that we need to see a transition in terms of what we are encouraging our kids to do and what we're teaching them. But that's an issue for the educators and for the psychologists of today,
right,
and tomorrow.
And maybe even a different TV program. Do you have, we have like another minute left, and this like flew by, and I so thank you for sharing yourself with us.
It's been my pleasure.
Do you have a blog? Is there something, can we put, I'll list your website so that maybe if anybody wants to kind of find out some of your insight and some of your tips, they can sign on to your website and see some of the information. Please.
Well, my website is www.drbev.com, and that's actually spelled out DOCTORBEV.com.
Good.
And I do a blog on my website, so just scroll down to the blog and then click onto it, and you'll be able to read the latest and the greatest about cosmetic surgery.
I've seen it, and that's why I think it'd be very insightful for people just to kind of check it out. So I want to thank you for coming on the program. I appreciate your insight and your thoughts. And I always thank you, our viewers, for continuing to write in and to share with me what it is that's on your mind and what concerns you have, and if there is an opportunity for me to help address them in this type of a forum, I try to do that. If you want a copy of the program, feel free to give us a call at 1-888-SIMON-SAYS, or reach out to the station that you're watching the show on, and continue to eat right, drink plenty of fluids, diet, exercise, and have a happy, healthy day. Thanks for tuning in.